So I'm Ferrell. I'm the Executive Director at Coronado SAFE. Coronado SAFE is a small nonprofit here in Coronado. The acronym stands for Student and Family Enrichment. Our vision is resilient kids able to face life's challenges. Our mission is to provide prevention and early intervention that improve the emotional and behavioral health of the youth in Coronado. We offer a variety of programs. We have programs for the parents. We have our monthly coffee talks where we bring in expert speakers. We also have parenting support groups. We have counseling for youth and their families. We have programs in all the public and private schools, pre-kindergarten all the way through the high school. Some are clubs, some are more support groups. We have a lot of different activities. Some we meet monthly, some we meet weekly, depending on the school and the program that we provide. Some of them are more in the sense of a support group for the kids who are struggling. Others are more of a universal prevention program, trying to build resiliency in kids. So mental health is really important with kids. There are a lot of studies out there right now, a lot of articles in the newspaper and Time magazine talking about anxiety and depression, suicide, drug abuse. So at Children's Rady's Hospital 10 years ago, they had 30 to 40 kids visit their ER for mental health issues. And in the last year at Children's Rady's Hospital, they had 300 to 400 kids on a monthly basis that were visiting the ER for mental health issues. Suicide is currently the #2 cause of death for teenagers. Recently, there was a Healthy Kids survey at Coronado High School specifically. 27% of those kids, last year's juniors, answered yes to this question. During the past 12 months, did you ever feel so sad or helpless almost every day for 2 weeks or more that you stopped doing some usual activities? So 27% of one class grade of about 300 kids, that would be about 81 kids just in that one grade. So parents in the community, we have our coffee talks for once a month. We bring in our guest speakers, and we also have the parenting classes. We do a variety of different classes depending on what the needs are in the community at the time. And then we just started support groups for parents. And so Coronado SAFE exists because we want to help kids, and we want to help families, and we want to make sure that we give them the tools that they have. We all go into the dumps sometimes. We all have difficulties. We all have problems, transitions in our life, and it's not always easy. But what we all need sometimes, is just somebody to help lift us up when we're feeling down and give us some tools and some life skills to make sure that we have good coping skills when we are feeling down. So if anybody is interested in supporting Coronado SAFE and the work that we're doing, we are really trying to expand our services. We've consistently had about 18 people on our wait list. As soon as we are able to get people off the wait list, people find out that there's space available, and then we get more put on. We are currently letting people know that we're so full that they need to refer out elsewhere. The problem is that people aren't going elsewhere. They want to stay in Coronado. Most of the counselors within the community and within the county are full, especially for adolescent psychiatry and psychology. And so we are really trying to expand our services, and so we really want to make sure that none of these kids slip through the cracks. So we're trying to double our budget so that we can do that. We're trying to work through the city and through the county, but so far those have not worked. So we are reaching out to community members. There are a lot of people in the community who are going to donate somewhere, and I understand that there's a lot of need in the entire world to donate to. But there's also need right here. And mental health issues, it doesn't matter how much money your people are making or where they're living, they need the support that they need. And sometimes it's even more difficult in Coronado, especially for kids, to reach out for help, or sometimes for them to get the help, because in addition to feeling down and depressed and anxiety and those issues, there's a level of shame that's added to it, because who are you to feel bad when you live in such a beautiful place and you have everything, and you live in Coronado? How can you complain? And so it's hard for us to get funding outside of Coronado, because that's how people perceive what's happening here. And so if we're going to support the youth in this community, it's going to have to be within the community. And the systems out there are broken. The ER is overloaded. I mean, we talked about Reedy's Children's Hospital and the number of kids that are going to the ER there. We don't have the systems in place to handle it within our entire country, let alone right here in Coronado.